Hey, Montel Williams here. Look, I've got some incredible news to share with you. I want to tell you about my brand new book that's coming out that's called The Sailing of the Intrepid. Now, this book is more than just an historical account. It's a tribute to the brave men who served aboard the USS Intrepid and a celebration of their extraordinary legacy. Writing this book was such an incredible story, and I'm really thrilled to be able to share it with you. So don't wait to grab your little piece of history. The book is available right now to order. You can go to montelmedia.com, and you can even get a limited autograph signed copy. Now, thank you so much for your support. I can't wait for you to read this incredible story of the sailing of the Intrepid. I'll see you on the pages. Well, hey guys, welcome back to Free Thinking with Montel, the podcast where we deep dive into the ideas, innovations, and individuals shaping our world. I'm your host, Montel Williams, and today we're tracking and tackling a topic that I think affects every single one of us out there. It's called healthcare. Here in the United States, we have some of the most advanced medical technology, world-class emergency services, and highly specialized care. But let's be real. Our healthcare system is also very inefficient, inequitable, and frankly, frustrating for nearly everyone who interacts with it. But what if I told you that disruption is not only coming, but it's already here? And what if I told you that that disruption could actually be the cure for what ails us in our healthcare system? My guest today is someone who knows this space inside and out. He's the author of the groundbreaking new book, The Great Healthcare Disruption, a distinguished physician, scientist, leader in academic medicine, and an advocate for integrating advanced technologies into healthcare. Dr. Marschall Runge, thank you so much for being a part of the show today. Thank you for being a part of Free Thinking with Montel.
Thank you, Montel. It's great to be on your show.
For sure. So let's have a free thinking conversation. I've been looking forward to this conversation quite a bit because I happen to kind of dabble in different areas of our healthcare system, working on innovative breakthroughs from everything from PTSD to traumatic brain injury to disc health and much more. I actually work in pharmaceuticals and nutraceuticals. So the great healthcare disruption is a wake-up call and a roadmap all in one. Before we dive into the details, let's start with the big picture. What inspired you to write this book?
Well, I had an opportunity. I was contacted by Forbes Books to contribute to one of their series. And I've been in healthcare 40 years now, more than that if you include all my training. And every day, part of my job is helping people navigate our healthcare system, helping them get appointments, trying to help them understand what their choices are in healthcare. And I think it's a perplexing situation. One, you described it perfectly. We have some of the most advanced healthcare in the world, but in other areas, we need a lot of improvement, and I think technology can help us.
You're not kidding. I mean, there are some areas where I think, we are really the pinnacle of healthcare in the world with some of our breakthroughs. But then again, at the same time, we are also, because of administrative and some bureaucratic inequities, we are, I think, near the bottom of the rung with some things. Let's talk about some of the major disruptors you highlight in the book. You mentioned retail medicine, AI, and even some like the new obesity drugs. Can you break down how these are reshaping the healthcare landscape?
Yes. So AI, let's start there. It's a popular topic, and I'm a big fan of AI. And AI is already having a positive impact on healthcare in several different ways. Not in what you might hear advertised about your next doctor is going to be an AI bot. I don't believe that. I believe our human connection is going to supersede that. But it's helping in everything from getting access to the healthcare system. When I speak to our patients or people, everyone has trouble getting an appointment. AI has made that improved dramatically. Another feature of AI is that it's made it easier for healthcare providers. So as a practical example, many of us have been to the doctor recently. I went to my internist for an annual checkup, and he's a terrific doctor, but he spends half the time taking notes on his computer. We're not really connecting. There's a new version of AI called ambient AI. It records everything that we say, and not only, it's not a transcript, it produces a very high quality medical note. That saves, whether it's physicians or nurses or therapist saves them an hour or two at the end of the day. So helpful. And the main thing for me, Montel, was when I saw my internist and when I've used this ambient I connect with people. And we've lost some of that connection just due to the bureaucracy of healthcare.
Well, let's explain how this works again. Is this sitting back, listening to the discussion between the doctor and the patient, and then it's filling in notes and, what's it doing?
So it's capturing. It's like when you ask your favorite AI engine a question and give it some information. it scours the room, scours the internet, and it responds to what you've asked it. It does the same thing. If you and I were talking, you're my doctor, I'm your patient. It would capture everything that we talked about and then say, well, here's what Marshall's major problems are, X, Y, Z. Here's his medications. Here's what are possible diagnoses. And it's not the final product because your doctor would have to read it carefully and make sure it didn't make any mistakes. But it essentially creates what would take me as a physician to dictate and then review it, take 15 to 20 minutes. And if you multiply that by 30 patients a day, you can see how that can have an enormous impact.
Absolutely. And it would kind of, not force, but kind of allow the doctor to rely on what are his personal skills in talking to his patient, right?
Exactly.
I have been working with a group for, man, I'm telling you, 7 years now. Maybe I give you a little bit of my history. I don't need you to evaluate me, but I'll just tell you a little bit of my background and why medicine has been so important to me. I got diagnosed with MS back in 2001. I went through multiple hospitals, from Johns Hopkins to Harvard to the Karolinska Institute to the Mayo Clinic. I was seeing doctors all over the world trying to chase, what I thought would be a cure or at least some sort of advantage by using all these doctors. And bottom line, I'm going to tell you the truth, what really helped me the most is going to the library myself. And this was back when libraries were more important than computers. So going to the library myself and sitting down, opening books and studying and reading and looking at, physician desk references and things like that, and finding and understanding that my disease for me, and then trying to figure out things that could help me mitigate some of the things that were causing some of my symptoms. I set that in action, and I have, I am a 69-year-old man with MS. No ifs, ands, or buts. I go to the doctor every single year. I see my neurologist every single year. However, to say I've kind of held this at bay, even most of my doctors can't understand why I am doing as well as I am doing and have been doing as well. But I think that some of the things that I started working with early on really helped to impact that. I had a severe hemorrhagic stroke in 2018, one that normally kills 50% of the people who have it. I was seen at Newark Presbyterian by some of the top doctors, stroke doctors in the country. One of them said to me that, but for the grace of God, the blood in my brain missed my brainstem by 1/100 of an inch, and that's probably what really saved me. But I had to recover from that, and I think I've done a pretty good job of that. And that's been to help with some really unbelievable doctors, and also try to actually insert things that I knew could make a difference, or I felt could make a difference. I would talk to the doctor about it. They said, no, I don't believe that. I'd say, okay, thank you very much. But as a test guinea pig for myself, I tried some things, and guess what? Some of those things seemed to help, and they work, and they continue to work even till now. So rather than succumbing to this, I've been thriving with it. But because of that, one of the things that stood out the most, when I had my stroke, I was, again, at New York Presbyterian, one of the top stroke hospitals in the country. And the doctor at the hospital asked me, well, you have MS. And I'm in my haze of my fourth day when I kind of, got lucid again, because the first 3 days was a blur. The fourth day when I was lucid, he said, I know your wife has told me about your history with MS, so you have multiple MS scans or you have multiple MRIs. Could we see some of those? And I said, yeah, I'll reach out to all the hospitals. I reached out to all the hospitals. I even was one of these guinea pigs. I did a 8-hour MRI back in the day.
Wow.
In
8 hours.
8 hours. They did spectroscopy on my brain and the whole 9 yards. And they had a three-dimensional image of my brain. I was one of the first people that ever had that done. I had multiple MRIs done at Johns Hopkins, multiple done at Walter Reed, Bethesda, had them done at Fort Meade, and also had them done at Harvard. And so I reached out to these hospitals to get these images. And guess what? Not one of those images could be read at the New York Presbyterian. None of them. So as we've made advances in medicine, one of the things that's trailed behind in medicine has been images. They still are giving people stupid CDs, and no computers have CD readers in them. How ignorant is this? So honestly, it was very funny. While in the hospital, and I spent 27 days in the hospital because of my stroke, a group reached out to me that had been working on a product that's called, this is something I'll just throw out to you, it's called My Medical Images. This company whose president has a storied history in imagery before that. I think some of his technology is being used in almost 80% of the hospitals around the world. He created a new paradigm with this My Medical Images that allows the patient to capture their images at a diagnostic quality level, share them in this portal that goes up into the cloud, and different than all the other portals out there that are literally, I like to say, there are a lot of people out there perpetrating and claiming that they can do this, but their mechanisms require anywhere from 5 to 10 steps. My Medical Images, in a 2-step process, you can share diagnostic quality images of any type, MRI, PET scans, CAT scans, MRIs, X-rays on your computer, your tablet, or your phone at a diagnostic quality level. They're all HIPAA compliant and meet all the requirements for imagery. This thing has been out here, and I'm going to tell you, it's so funny. We're talking, and the president of the company is calling me right this second. He must have heard his ears must be breaking or something. But this thing we have been traveling around now for, I'm telling you, when I heard about it, because I knew what I was dealing with at New York Presbyterian, I wanted to help. I said, this thing would be a major breakthrough when it comes to imaging and healthcare in the United States. And I got to tell you something. Another doctor who was one of the leading neurologists in this country said to me one time when I was working on a medical device that works on neuromodulation, said to me, Montel, any breakthrough technology like this is normally met by the medical community with the most vehement, adamant resistance. Because if they didn't learn it, they don't believe it. And he's absolutely right. Because now for 6 years, we have been everywhere, from the DOD to the VA to Health and Human Services to the FDA, trying to convince them to take a look at this. But, of course, no, one of that area, which is imaging, is controlled by a group of doctors who are really just guys who just can't look out past their collars. So how do we break that first? First off, we got to kind of, I think, maybe start medical schools all over. And the first thing they teach you is not the Hippocratic Oath, is they teach you are not God. Because if you are God, you will be sick. So therefore, you don't have all the answers, and there are other answers that are out there. But how do we break that kind of a quagmire?
Well, I think that we're seeing that already. And so I'm familiar with that technology. We don't use it here, but believe me, we're going to take a close look at it. And excuse me. So when I was writing this book, The Great Healthcare Disruption, I looked at all the AI startups that I could find. And there were over 100 new AI startups. And of those 100, some will succeed, some won't succeed. But I think that that control that you talked about by a group of doctors, I think, is getting less and less, because we're understanding. I understand. We understand that an important part of healthcare, and I'm going to use a word that some doctors wouldn't use, is the consumer of healthcare. We have to put them at the top. I mean, that they are why we're here. And so I think this is going to be consumer driven. Since you mentioned stroke, I wanted to tell you about another AI innovation. So you know this probably better than almost anybody in your audience. But when you have a stroke, particularly a hemorrhagic stroke, time is tissue or time is brain tissue. And so there's new technology that is in place now that uses AI to look at CAT scans for people that come in with a stroke, and it instantly activates the stroke team. So doesn't wait for a radiologist to look at it, doesn't wait for uh, the final report on the CT. It activates the stroke team, and Columbia Presbyterian has a fantastic stroke team. And so, yeah, well, maybe every once in a while, not very commonly, every once in a while, the machine gets it wrong and it wasn't a stroke. But almost every time it is a stroke, the accuracy is great. And as a result of that, people get much faster, better treatment for their stroke than they would otherwise. And Montel, I have to tell you, I would never have guessed that you had either MS or had a stroke in the recent past. So this is where we have to be in medicine. This is what we can do, and we have to figure out how can we deliver this level of care to everybody all the time.
So, Doc, I mean, just on that note, like, see, again, if the people controlling the images, well, recently, I guess, Elon Musk has suggested a AI platform that could literally do some research into cancer. So he wanted people around the country to send their images in, and of course, they have no real viable way to do that. There are a couple of instances, but most people aren't going to go through the 15, 20 steps to get that done to get them in.
Right.
Whereas the My Medical Images could just, boom, have them there immediately. But we could be evaluating not just stroke, we're evaluating cancer. I mean, let's say, they got an opportunity to look at 600 million different or 100 million different images of cancer. I would think that the AI could evaluate that in a way that scientists and humans have not been able to do so to date, right?
Absolutely. And AI has some enormous strengths. One is around imaging. It is very good at image analysis. But the other is analyzing massive amounts of data and being able to pull that together. So a project like you just mentioned of looking at cancer images would be accompanied by data about the patients, the people's genomics and proteomics and all kinds of markers that then the AI can pull together and create a full picture. So if you have a cancer that looks like this, and you have a genotype that is a certain way, that will AI will be able to figure out, is that a prognostic indicator that you need to get something done immediately, or is that a slow growing cancer? All kinds of questions.
I was reading an article recently about someone who had gone in and literally discovered they had a form of lung cancer, successfully treated it, and then I guess the doctors took the images that they had taken during or after the successful treatment and compared them to images from 3 or 4 years earlier that this person had taken just in a routine chest x-ray. I think it was x-rays that were taken during COVID. And though they weren't diagnosed then, there was some sort of AI, put on that literally indicated that had they looked at it differently 4 years earlier, they would have detected the very beginning of cancer. So I guess, AI could probably speed up that prognosis and diagnosis opportunities like you're talking about, right?
For sure. Just to give you a little example of the power of AI, as you know, you just said, you get images, you get your medical records on a CD or a USB, and it's piles, if you were to print it, piles and piles of paper. If you make a PDF of that and feed it into your favorite AI engine, in 30 seconds or a minute, it'll give you if you want a one-page summary of yourself or a 5-page summary of yourself. And the data, it scours all that data. And so why is that important? Well, first of all, it's pretty cool, but also somebody, otherwise a person has to go through those hundreds of pages and they may miss things. And AI is very good at not missing things. And that example of looking at those prior chest x-rays is a good example of that, because you see lots of little divots on a chest x-ray that may or may not be of importance. But when you put it in the big picture of what's going on with that person, then it can be important, just as you described.
And talk a little bit about this new. I'm not a naysayer, but I've been one of these people who's been very cautious about the fact that we discovered a drug for obesity that works for obesity, though it was for something else. And everybody jumped aboard. But I've been one of these people who've been saying, be careful how quick we jump onto something that we don't really know that much about, because we've not followed this thing out for 5, 6, 7, 8 years to figure out whether or not we could be doing harm rather than doing good. And AI could probably take a hard look at something like that too, correct?
Yeah, and I think one thing AI can do is look and see if there are, again, factors that might make somebody more prone to having a complication with one of those drugs. But I'll talk for a moment about these so-called weight loss drugs. They mimic a hormone called GLP-1, and these drugs were developed for diabetes. And then it turned out that the people that were receiving these drugs lost a lot of weight. And then studies started going on. So they have been used in clinical studies now for more than 10 years. So there's pretty good experience with these. Then it turns out that they have all kinds of other positive impacts. So one way to think about obesity is that many people who are obese have a low level of this hormone that causes them to be satisfied with, to reach satiety. And it turns out this isn't acting in the gut. It's not acting in the stomach. It's acting in the brain. And what it does is it diminishes the release of a neurohormone called dopamine. And how does dopamine get stimulated? Well, it gets stimulated if you do something exciting. If you're afraid, if you eat your favorite food, smoke cigarettes, if you drink alcohol, for some people, if they gamble. And it turns out that many of these different addictive phenomenon have now been studied with these drugs. And it looks like this class of drugs may be helpful in lots of different ways. And it all started by happenstance. Now, AI is now being used in drug discovery by Big Pharma, and it is really accelerating the development of drugs that we never would have considered 10, 15 years ago. So you're right, though. You're right to be cautious, because there's a litany of drugs that looked great to start with that turned out to have side effects. I think AI will also help us understand what parts of those drugs are resulting in side effects. So it's a big, bold future, but I think in terms of the weight loss drugs, I think they're the real deal.
Gotcha. Now, you've mentioned reimagining primary care through virtual and retail channels. What does the primary care doctor of the future look like, and how will their role evolve?
That's a great question. And when I started looking at the topic, I think everyone knows how expensive, relatively speaking, American healthcare is. We're at the top of all the economically developed countries in the world. But if you look at the number of primary care doctors we have, it's at the bottom of that list. So we first of all have far fewer primary care doctors than other similar countries.
And I'll pause you for just a second on that note, because it's been something that I have been talking about for years. And I think even, the American Medical Association has been talking about it for years. The fact that, we have a society now that's so caught up in becoming internet and virtual stars rather than going to school to become primary doctors and nurses. As a matter of fact, I read a study about 3 years ago talking about the fact that by 2025, we could be close to 300,000 nurses short in America,
Right.
over 200,000 doctors short. So as we keep moving down the path of the future, we may be in a place where, there's not a doctor within an hour. There's not a doctor within 2 hours. There may be doctors within 3 hours. So we're going to have to depend a lot more on computers and things like that to have interactions with a doctor than we ever thought. But and how do we turn that around? Because we've got to start the pipeline early and start, at least recommending medical school to people, when they're in junior high school, so that they don't start thinking about being a rock star by the time they graduate.
Right. I think we can do a lot to make medicine more, or healthcare in general, more of interest to young people. For example, there are a number of programs who bring in, and we have one here, we bring in 400 or 500 middle school students that range from very impoverished areas to less impoverished areas. They come, Michigan has a huge football stadium called the Big House. They come to the Big House. We have 35 stations set up where they can learn about all kinds of things. They can get a little bit of hands-on experience, what it's like to uh, be in an emergency room setting. So I think we need to pay a lot more attention to encouraging people to go into healthcare because it's a great field, very rewarding. But at the same time, we got to use technology to make it a better life for people.
And
And
we
I think,
also have to start respecting you guys a little bit more at the same time. I mean,
yeah,
I'm sitting there talking in one way out of one side of my mouth saying that, you're not God, but at the same time, we need to start, talking about doctors. We need to start including you as members of our society and all of our programming and our movies and things. I mean, we kind of, too often, I think, take too many shots at doctors in the medical community rather than uplifting it the way that it should be. But that's just my thought.
oh, I can't tell you how happy I am to hear you say that because if we have thought leaders like yourself who say that, I think that has an impact on people. Um, and it is true that being a physician these days, being a doctor, is a highly regarded field, but it's dropped and the trust level has dropped. And I think part of that is just the cacophony of voices on social media and other places that will throw a dart at almost anything. So we have some work to do to regain the trust of the American public because they're looking at things much more closely than they did. And it's not like it was when I was a kid where you just believed what the doctor said. People go back and check.
Yeah, but I think we have this issue in America where we don't care until we need it
Yeah.
individually, and all of a sudden, oh my God, doctors are the best thing in the world. I mean, but I'll knock them until I need one myself or somebody in my family does. While retail medicine offers convenience for some, I mean, but there are some critics out there that worry about the quality of care in some of these settings. I mean, you see all these retail places popping up all over the place. How do we balance the accessibility with maintaining high standards of quality of care?
Well, we have to have ways to look at quality, and each of these new, what I'll call new entrants into healthcare, has to meet certain quality standards, and I think that's an important concept. Um, but going back to the world we live in, the consumer world we live in, people are they're used to not having to go to the mall and spend 3 hours trying to find the right pair of shoes. They just go online and find the right pair of shoes, and they expect the same in healthcare. So um, there are many, no, there's several reputable 24/7 uh, consult services that they're telehealth, but they're available. And when you were talking about imaging and accessing imaging, it reminded me that one of the big challenges in healthcare is interconnectability. So if I call up Amazon Clinic at night, I'll get advice, but the doctor there doesn't know what my medical record is really, except for what I tell them. And uh, my doctor won't know what I did with Amazon. And there are technology ways to connect those. We haven't gotten there yet. I think we need to really re-emphasize how important it is that all the medical records are connect. And so when you were looking for your scans from 3 or 4 different hospitals, they're connected. So the folks at Columbia Presbyterian can just look online and find them. And so we're not that far away. We can get there.
Now, your book is called The Great Healthcare Disruption, right? And
Yes.
just came out. Where can people go to get a copy?
Well, it's available wherever they sell books. If you like independent bookstores, they're there. If you like Barnes and Nobles, it's also available all the online places. And whatever is most convenient for you or what you like to do.
And if people wanted to reach out to you or reach out to or read some of the things that you've written about other than in your book, where can they go? Is there a website?
Yeah, got a website. It's drmarschallrunge.com, and I'll spell it. So it's DrMarschallRunge. That's my name, all one word.com. And it has all the information they could look for.
Super. Now, you and I share, feelings about this. You also talk a lot about your book about shifting focus from treating illness to preventing disease. And how do we convince the entire medical community and the recipients, patients, people, the individuals, how to understand? I mean, it's like, again, when I got diagnosed with MS, I'll tell you a very, very, very crazy story. I wrote about it in one of my books. The doctor who diagnosed me, I'll back up in time. I have, because of my military experience and because I've worked out and exercised my whole life, I became one of those weight head guys. You know what I mean? I was in the Marine Corps and the Navy. I graduated from Naval Academy. I was on the Naval Academy powerlifting team. So I was a big weight head. I used to think that the more weight you threw around and the bigger you were, the bigger man you were. So, it was a period of time when I was walking around, out of season at 220 pounds. You know what I mean? And I literally had a 28-inch waist, but I was wearing like a 46 jacket.
Wow.
So I was huge, and I competed as a competitive bodybuilder for a while. And when I got diagnosed with MS, I walked into a doctor's office, and what was really funny about it is I thought that I had hurt my back powerlifting. And so when I went into the doctor's office, I was literally sitting in the doctor's office at 219. I was like all muscled out, and the doc said to me, well, all that weightlifting's got to stop. And, you got to stop this and you got to stop that. You got to stop this. So, wait a minute, dude, you didn't know me yesterday. So how can you tell me what I got to stop doing? Why don't you tell me what I can do? And he didn't answer me. And I was very upset with the diagnosis. I left there and I said, no, I've got to figure this out myself. So being the engineer that I am, I went to the library, of course. And I started picking up books on MS and on neurological disease and all kinds of things, and started figuring out that, one of my biggest nemesis with this disease was going to be inflammation for the rest of my life. So how do I fight inflammation? How can I try to reduce the level of inflammation in my body to be in? So that's when I decided, maybe he's right. I'm putting a little bit too much stress. My natural body weight is what I am right now, is about 185, 186 pounds. When I graduated from college, when I entered college, I weighed 145 pounds. I used to box as a welterweight, so I was a little too skinny. But then, I was 6 foot tall, 145. And I decided, yes, I need to lower not just some of the resistance that I'm pushing around, but I need to just get my body weight down to a reasonable weight that I can manage better. And then I started focusing on my diet, focusing on other things that could help reduce some of the inflammation in my body, that really, really, really helped me. And I went almost on a vegan diet immediately, just because I was really putting in, 2-3 steaks a day and that kind of stuff. So, I kind of had to, just to maintain that weight, I was eating that much. And that forced me to start considering the things that I could do to help impact my illness. And it became my responsibility. I came up with this little term, taking care of, back then we had this whole carbon footprint issue going on in America. And I thought, how about our healthcare footprint? Each of us is responsible for our healthcare footprint as much as asking a doctor for advice about our health footprint. What can I do that can make a difference? And, to be able to convince most people that they need to focus on treating and preventing things from happening rather than trying to treat it after it's happened is a tough leap. Convince those people, hey, you can't eat ice cream every single night. Well, I can eat ice cream once a week. I don't have to eat it every night. I can eat it once a week if I want to treat, or I can eat a cookie once every 10 days, 15 days if I want to treat. I try to reduce the amount of sugar intake. I got rid of sugary drinks and stopped drinking alcohol. It was one of the best things I did, I believe, when I was first diagnosed. I completely stopped drinking alcohol. I may have one sip of, I say sip, I'm talking less than a teaspoon of champagne every New Year's. That's it. Drink.
Wow.
And it really, now I know other people who were diagnosed at the same time I was. There was a period of time when my disease was progressing rather quickly. But when I stopped and I started working on certain things, all that progression stopped almost immediately. So I was taking responsibility for the things I could do, along with being on the medication that I'm on. I'm on some Western medication, but I'm also on some Eastern medication. I've worked on neuromodulation and some other things that have really helped me. And it's hard to convince people that if you put as much work into prevention as you do into trying to figure out what to do after you've been diagnosed, you might prevent that pain and suffering of the diagnosis. How do we convince more people that they've got to start stepping up to the plate? You don't hear the messages, because the messages I hear is, just take a pill. Just add this new pill. Get this new pill. Don't worry about it. You got to take this pill. We got to knock that mess off.
Well, let me just say, to start with, yours is an inspirational story. And if we could get 20% of the country to do what you do, we'd be a way healthier society. So, congratulations on everything you're doing.
Thank you.
A couple of things, common features of what you talked about, I think are important. And then one is there is no pill to be healthy. There's not a healthy pill. Um, People are searching for it, or if you look at some of these people who are trying to reverse aging, they're taking 90 nutraceuticals a day, and it's not a pill. Um, but you comment on inflammation, and for your listeners, if you haven't talked to them about inflammation before, that is a common denominator in health, and reducing inflammation is a common denominator in becoming healthier. And you've done an awful lot of things to achieve that. I in my book, I talk about preventive health, and I think that's the solution to American healthcare. We talk about how expensive it is, how it's unsustainable. If we get healthier, that's the solution. We don't need so much healthcare, and it won't be so expensive. But uh, there's also an overlap with aging, and I do have a chapter on aging, and people are very concerned about aging these days. And what I found is I scoured the literature. Now I did it by internet, not by going to the library, but as I scoured the literature, what I found is there are a few common factors that are amazingly make sense. Maybe the most important is sleep, and so sleep, disturbed sleep habits, staying up too late, not getting enough rest, that is a common contributor to not only inflammation but to obesity, poor health. There's sleep. There's several books out there now about healthy aging, and they all talk about fitness is not viable. Not being fit is not viable. And so, you think about sleep, you think about fitness, you think about community, having friends or family that you relate to, and a couple of other factors. And it's things that you can do. You don't have to go to um, a a medicine. But on the other hand, these are hard things to do. So I'm gonna put it back on you, Montel, and say, well, how did you what came to you and enabled you to achieve what you've achieved through healthy living?
It's figuring out what I would be like if I did not do this. Once I realized the other side, I realized that, just like you read now, of course, nowadays, because I don't go to the library, of course, to do the internet. I've read some amazing articles in recent times about the fact that, one of the best healthcare, one of the best hacks, one of the best pills that you could take is not taking a pill, is taking your butt to the gym, taking
Yeah.
your butt outside, walking around, get into nature, smell the air, get some really good air in you. I just blessedly turned 69 this last week. I think I earned every one of those days. Um, but even at 69, today, when we're done this interview, I will go down to the gym. I will go to the gym. I go to the gym every day. I try to now. In the last 3 months, I probably have I made it 6 days a week? Yes. Have I made it 7 days a week? A couple of times I have, not every day, but I try to. And people say, well, I don't have the time. Oh, if you got the time to wake up, you got the time to go exercise. You have the time to wake up. When you get up in the morning while you're standing at the kitchen, at the sink, brushing your teeth, do leg raises while you're standing there if that's all your time you have. If all the time you have is to sit down in a chair while I'm sitting here with you, I could be sitting here doing, knee-ups right now. As long as I'm doing something every single day, I think I am taking a pill every single day that's contributing to my good health. And what's the difference? If I don't do it, I know where I could end up. And I don't want to end up there prematurely. Can I stop the clock? Hell no. Nobody can. I don't care. I don't care if you end up taking 95 nutraceuticals a day. Yeah, okay. But could you stretch it by a month or two? Maybe. But the jury's still out on that. We don't know. There's all these new chemicals that are coming down the pike now. There's supposedly people in different areas of the country that are, doing these cocktails of different chemicals that seem to have helped a little bit in longevity. I happen to actually be working very closely with some people who are in the biologics field. When I'm talking
Mhm.
about biologics, I'm talking about everything from exosomes to, you know, um, some of the other breakthroughs that they found. And yes, will we find out 10 or 20 years from now that, yeah, that might make a difference in my life in 3 or 4 months. But guess what? Taking a 2-mile walk every day is going to make a difference in my life of about 6 or 7 or 8 months. And those 6 or 7 or 8 months are going to be a better quality than if I just took a pill, because I'm still going to be able to move around. I'm still going to be able to reach down and put on my socks. I'm still going to be able to, if I drop something on the street, I can reach down and pick it up before it blows away. We have to start to convince people. And I mean, it's, I got to tell you, I wish I had an opportunity to speak before groups of doctors like yourself. Because I'm going to tell you, I think part of the problem is, please, sir, this is not an aspersion, but some part of the problem is that some of your guys don't know how to communicate this message to the patient.
Yeah.
They got to figure that we got to get you out of the book and get you hanging out so that you can kind of talk, on a non-book level to convince people that, hey, you know what? I wish I could help you, or no, I want to help you if you're sick, but I don't really want to see you. See, that should be the message for myself. I don't want to see you. If I saw a commercial every day that was coming on as much as I see these commercials come on for this drug, that drug, this drug, that drug, if the pharmaceutical industry were to sponsor commercials that said, you know what, we don't want you to buy this drug. We don't want you to have to need this drug. We're here if you need us, but let me tell you what you can do so you don't need us. I guarantee you, 3 months of that, sales will go through the roof.
I got to tell you, I love that idea. I think that's an awesome idea. And I also really think that having the potential to have you and people like you in front of a group of doctors and others. And I'm gonna work on this a little bit and get back to you about ways that you could help us tremendously.
Sure.
And last thing I was going to say about that, but I have one other comment is, I don't know if you've written a book or have a audio book about what you have done, but I think that would be so powerful coming from you.
I have a couple of books out. I've written 9. 2 of them, one of them was Living Well with Montel and Living Well Emotionally.
Oh, I've seen that book. I haven't read it though. I got to read it.
Oh, please, get a read on it. I think you'll enjoy it because I talk about all this there, and I've had some of the top doctors in the world actually contribute to those books because, and maybe it's time to revisit them, or maybe it's time to re-spark them. But, I think if we don't start to convince the populace to take as much responsibility for their healthcare footprint as we claim that they need to take responsibility for their carbon footprint, we have seen our better days on this planet.
Yeah, I agree. The other topic I wanted to mention, and you undoubtedly know all about this, it's a phenomenon called epigenetics.
Yes.
So epigenetics, for your listeners who don't know about this, these aren't genes. These are proteins that respond to your environment. And so by your environment, I don't mean just where you're sitting. I mean all the things you're talking about doing to improve your health. And they either turn on genes that are healthy genes and anti-inflammatory genes, or if you sit there and eat ice cream all night long while never exercising and being a couch potato, they turn on the genes, they turn off those genes, and they turn on the genes that are going to cause inflammation. And I think that as we learn a little bit more about how to measure that, people respond to a measure, I think. And so if there's a measure of their epigenomic risk, I think, and you can see it change. People who've done things like you, I read a recent book by Eric Topol who talked about some of this a little bit.
Dr. Temple?
Yeah.
Yes, I know Dr. Temple. But go ahead.
So great guy. He and I worked together at Johns Hopkins when he was a cardiology fellow and I was a resident.
Okay.
Great person.
Really great person.
And a real expert in these areas. And so I think that he showed some of his own data and how different factors were in inflammatory factors. This is in a recent book he wrote about superagers. So I think these things they're definitely real. And so the communication part, though, that you're so good at, the communication part is where we could have a big impact. Hadn't thought about it until I had a chance to talk to you today.
Well, I have spoken before the AMA. I've spoken before the ANA, the American Nurses Society Association. I spoke recently about a year ago in front of the integrative medicine doctors. I've been doing this quite a bit, and I'll continue to do it as I'm working with some doctors all over the country with different things and different modalities of trying to just make life better for people. One of the things that I also would love to hear your thoughts on is that how do we get this fragile healthcare system that can be especially fragile during crises like we saw during COVID.
Yeah.
We basically saw somebody throw a grenade in the middle of the room. Because doctors were like, I don't know what to do. And that kind of freaked a lot of
That's a good visual there.
huh? What's that?
That was a good visual you had.
No, but we saw a lot of doctors freaking out, and that I think is what. This is not blame. I'm just saying that the fact that when COVID hit, it gave those naysayers of medicine an opportunity to say, see, they don't know what they're talking about. And where, and it's almost like, you know, again, we have tried to teach people and lead people by giving giving them the impression that we're infallible. And the truth of the matter is, to be able to say we didn't know everything about this COVID vaccine or this COVID virus, we didn't know everything. Sorry, folks, this is what real life is about. Let's stop for a second. We know what's going on this planet right now as we see more, whether you call it global warming, planet change, whatever. I don't care what the titles are, but we know that the planet's getting hotter. There's no question.
Yeah.
And because of that, we have ice melts and melts happening all over the planet, where we have places that had not seen oxygen in a million years are now starting to melt out. There are viruses that are caught in that are now being released into the atmosphere. Something's going to come down the pike in the next year or so that could be something that was here a million years ago that we have no immunity to. And
Right.
human beings have to understand that's not any doctor's fault. That's not science's fault. That's a fault of the fact that we didn't know it existed. And, there was no way to find out that it existed. And yet we try to act like we know everything where we don't know everything. So, I guess to say it's a really weird knife edge that you guys have to try to run along. You have to run along this knife edge that says, I'm going to try my best to help you the best I can, but I could slip off because I don't know everything. But accept the fact that what I do know will help you. And once we start getting that into the minds of patients, we start getting that into the minds of children. I go back to this thing again. I swear to you, sir, if you approach, I'll go with you. You tell me which pharmaceutical agency you want to go talk to. Let's talk to the first one. I don't care if it's Pfizer, it doesn't matter who it is. Let's go talk to them and say, look, guys, I got a whole series of public service announcements that I know if you put out there right now today, it'll impact your sales numbers and they'll increase by 100% because people will then believe you care.
Yep. Absolutely. One of the chapters in the book is about what happens when we have our next healthcare crisis, and we're going to have one. Just as you said, we don't know what the future is going to be, but we have to be prepared for it. Coming back to a couple of things, one topic is I do have close ties to one of the major pharmaceutical companies, and I'm going to talk to them about this public service announcement idea because I think it's a great idea. And at the end of the day, I think pharmaceutical companies, they're about health. They want to improve health. Now, they have a business too, of course, but they want to improve health. And I think you're spot on about the importance of a publicity campaign about health.
Sure.
Love to see that.
And, but how do we continue to make sure that this healthcare system that we have stays resilient? I mean, what are we doing? And you would have the answer to this, but I'm sure that there's things that are going on right now to try to prep us for future issues. But, resilience is a big, wide word. And that's a wide word that really, I think, the healthcare community in America needs to embrace and understand at every single level, we can start applying new methods of resilience to foster better outcomes. I mean, what do you look at when you see resilience in our healthcare community?
Well, I think the topic of improving health in with multiple approaches that we've commented on already is very important. I also am a believer that uh, government provided health care is very good. And I've worked in several settings. One is there are these clinics called federally qualified health centers that are generally are in low income areas, and they provide a terrific service. I've also worked in the Indian Health Service, same thing, a terrific service. And so I think as we think about the future, it's important to think, how do we get everybody some level of health care? Because some of the worst outcomes are because people they don't have any health care. And so they wait until they're really, really sick before they seek health care. And a lot of health care can be the education you've just been talking about in terms of health.
Right.
So I think we got to figure that one out. It's a hot potato politically, and I'm not talking about a gold plated health plan for everybody. I'm talking about just access to basic health care.
Well, there was a moment in time years ago where there was a talk about trying to incentivize to give people reductions in the price of their insurance and things like that if in fact they followed certain steps. I mean, I think that's timing. The time for that was too soon years ago, but I think it's there now because people recognize how much healthcare impacts their pocketbook. So if I were to say to a person, if you can show me by your by what you do, that number one, I've got a patient that comes in. Of course, I put them on the weight reducing drugs, but they actually start showing a reduction in weight. And then they start
Right.
showing me and say, look, I want you, because again, of AI, I want you to start typing out or writing down, everything you eat, everything you consume. I want you to write this down every day. If you do it every day, you do it for the next 90 days, and we can then process this and take a look at it and see where you are and what's been helping you. I'm going to give you a 5% reduction in your medical costs. I'm going to give you a 10% reduction. You do what I tell you, I'm going to start reducing your costs rather than increasing your costs. More and more people will do the right thing, but you got to start it. And we have to get somebody who's bold enough to say, you know what, I'm ready to do that. Because you got the patients are there. You ain't running. You're not going to run out of anybody. The patients are
Right.
going to be there. So if I can reduce the load of 90 patients a day to 30 a day, I'm still going to make the same amount of money. But my outcomes are going to be better because I'm only dealing with a smaller group. So that's another one of those things that I think healthcare could use. I mean, with all these new devices, wearable apps, and patients have the tools that they need that they've never had before to help manage their healthcare. How do we empower those patients to take an active role in pursuing more information about these kinds of things?
I'm glad you brought up wearables, and I think they're one great great potential for improving health because they allow you to track things easily. We did a study here 4 or 5 years ago in which we looked at blood pressure control and used a wearable. We used the Apple Watch basically to track blood pressure. It does track blood pressure, by the way, and that was a powerful motivator for people. Rather than having to go put a blood pressure cuff on and pump it up or buy one. And so I think wearables are a part of the solution. I also think that your idea of reducing costs by for reasons of improving health is powerful. I'll give you one little example that I learned about. Singapore is a very healthy nation. And one of the things that they've done in Singapore, they've done two things. One is they heavily tax junk food, basically ultra-processed food. And they take the money from taxing that and they use it to make healthy food more affordable, more available. And that's one thing. The other thing is it's a different kind of community. It's a walking community. They make it really expensive to drive. So parking places, driver's license, auto tags are very expensive. And so these are interventions, and they have a system that rewards people for these healthy habits, and in essence penalizes them for not doing things that are healthy for them. You talked about moving your knees up and down while you're brushing your teeth. That isn't important. Whatever we can do is important. So I think money isn't everything, but it sure is a good motivator.
Sure is a good motivator. And you know what? I mean, that's pretty incredible. I didn't realize I've been to Singapore, but I didn't realize that they incentivized health that way by making you pay for the things that are unhealthy. And I think that's really
Right.
something that we should start doing here in this country, and getting rid of some of these food and healthy food deserts in America, and making sure that everybody has access to good food. I've run you over a little bit, but I got one more question for you. How do we address, the biggest issue I think it's facing the American healthcare system right now, and that is burnout among healthcare professionals? I mean, how do we help, number one, recruit more? And how do we, number two, you said the program that you have where you bring in junior high school kids into the hospital is one way, but, there got to be some more practical steps that we can use to help support our healthcare workers and workforces rather than continue to burn them out the way that we are.
Well, I'm going to start on the getting people into healthcare. Another approach that's been used some and could be used so much more is having a focus on health in education, K1 through 12. And that's fallen off a bit. And I think that from when I was a kid, and I think that focusing on that can get people, it could be targeted to get people interested in careers in healthcare. And we need everybody. You mentioned the shortage of nurses and doctors, but therapists, it's everybody. I think we got behind the eight ball in terms of burnout during the COVID pandemic. And we learned a lot of lessons. And I think the most important lesson is we need to make it possible for people to be in healthcare and to have time and presence of mind to do the things that you're doing, Montel, to maintain your health. And during the pandemic, people were working full out. They were exhausted. They were emotionally exhausted from all these poor people coming to the hospital and dying. And so I think that we need to change how we deliver healthcare. And your example of a doctor who focuses on health and has 30 patients instead of 90 patients, I mean, that could be transformative. So I don't have exactly the answers, but I think I don't have all the answers really. But I think the notion is the right notion. Let's make the life of healthcare providers a regular life and not one that you have to be a saint to go into, or you have to feel like a saint. And so I think that's doable. And it starts with education.
Well, Dr. Runge, you are a saint, no ifs, ands, or buts. And I thank you for writing your book. Again, it's called The Healthcare Disruptor, right?
Disruption.
Healthcare Disruption. Tell people again where they can go to get it.
Any bookstore, online, Barnes & Nobles, independent bookstores, it's everywhere.
I got to thank you so much for being a part of the show today, sir. So enlightening. I know that my viewers are going to love this conversation. And I didn't even get to ask you half the questions that I wanted to ask you. So please, you got to just come back, please.
Oh, absolutely. Thank you so much. Privileged to be on this show.
No, sir, for sure. And make sure you tune in and keep tuning in to Free Thinking with Montel. Thanks for joining me on Let's Be Blunt with Montel. Please make sure you're subscribed and hit the bell to be notified when new episodes post each week. We'd love to hear your feedback also, so please send us your comments. Military Makeover is so grateful for the support of Purple Heart Homes, a nonprofit organization that rebuilds and transforms the homes for our veterans.
Our heroes come home with sacrifices most of us can't imagine. As a veteran myself, I've been there and founded Purple Heart Homes to help.
When I tell the story of Purple Heart Homes, it's the freedom to not have to depend on somebody else to do the simple everyday things in life.
Visit phhusa.org/makeover to learn how you can help.